Okay, welcome to Labor and Health this morning. The crowd's getting a little bit bigger. Quick reminders, if you got a cell phone, leave it on because if a cell phone goes off while we're in here, you buy donuts for the next meeting. So please leave your cell phones on. Secondly, just for the committee members or for any public members, I've just got a list of bills for next Monday, Wednesday, and Friday if you're interested. The notices will come out as regular, but if anybody wants to do homework between now and then, please feel free. Monday, we're going to hear Senate File 26, 10, and 8. Wednesday, we're going to hear Senate File 79 and 94. Friday, a week from today, we're going to hear Senate File 65, 72, and 2. Yes, a joint resolution, not Senate File, excuse me, 2. And there's some fairly interesting legislation in there. We try to get more interesting as we go. Today, we have 3 bills before us. All 3 of them happen to be sponsored by myself. They're all 3 fairly short bills. That doesn't mean there's not a lot of sentiment and testimony on them, but we'll try to get through them. We're going to check out of here by 9:25. We're gaveling in at 9:30, so we're going to hope to keep it moving here. I meant to mention last night that we might use shock collars if necessary. I forgot them, so you're all safe. Let's start today by Senate File 7, and I'll go ahead and just present it here real quick. Presentation of the bill is very short. The name of this one is the opioid antagonist amendments. Essentially what this does, just to briefly tell you what happens, we passed a bill, and I can't tell you either, perhaps let Representative Barlow or Senator Barlow would remember from his representative days, but we passed a bill making opioid antagonists more readily available to the public, which becomes even more important as we go with the opioid overdose problems that we have. Matter of fact, I was just reading yesterday that the DEA passed some new regulations about opioid antagonists and about opioid, et cetera, et cetera. So some new rules coming out because the epidemic is becoming overwhelming. But what this bill does, we passed a bill naming specifically one drug, naloxone, Narcan. And that's all we put in the statute was Narcan. Now, as it turns out, there's some developments in the pharmaceutical world. There's more than one molecule now. There's some new drugs being made that also fit the same bill, that do the same thing as Narcan. So what this bill intends to do is expand that out so that as new things come along, and likely there'll be more. This won't be the last one. There'll be more drugs come along. And so that's the whole intent of this bill, is to expand that definition out, to not leave the other molecules out, which are equally as effective and equally as important. So in a nutshell, that's the explanation of the bill. And before I go any further, I want to make sure that Senator Bouchard is listed as excused. Everyone else is here. So with that in mind, let's take some public testimony. Let's talk with people in the room that would like to testify. Anybody from the agency first? Somehow I suspected he was going to jump up. Good to see you this morning.
Good to see you too, Mr. Chairman. Mr. Chairman, members of the committee, my name is Matt Martineau. I'm the Executive Director for the Wyoming State Board of Pharmacy. Really, Senate File 7, like Senator Baldwin, just expands it. From the board's perspective, we're neutral. It doesn't affect or change any of our responsibilities. We would have to amend some rules, but that's easy to do, and we're happy to do that in collaboration and time it with you guys to the best that we can. But otherwise, I'm here and happy to answer any questions you may have.
Questions, committee? Senator Barlow.
Thank you. Are some of those other devices or pharmaceuticals actually available now on the market? And the reason I ask that is we want to make it effective immediately instead of waiting until July 1st. Obviously, you'd have to do some rule changes, but emergency rules happen too. So anyway, Mr. Chairman, just is there new things available now that we should be trying to get on the pipeline sooner? Thank you, Mr. Chairman.
Go ahead, Mr. Martineau.
Chairman Baldwin, Senator Barlow, yes, there are other medications besides naloxone that are available, and specifically for opiate antagonism. FDA has announced, and I believe just recently in November, that they're making a preliminary assessment to make certain naloxone products available over the counter. The feds also passed some laws regarding medication-assisted treatment to remove something called the DAT waiver, which was something that limited the number of patients that a provider could see and manage and prescribe buprenorphine products for. So by removing that DAT waiver, that opens it up to where more practitioners can help to prescribe this and manage this. It potentially also opens the door for other sorts of practitioners to be able to play a role in it as well. It's something that if the legislature wants to pursue in the future, that could be an area where pharmacy could potentially step in and play a role similar to what they did during the COVID pandemic. But that's probably me speaking beyond my role as the director for the board.
Further questions? Senator Hutchings.
Yes, Mr. Chairman, thank you. Sir, when you said that naloxone may be offered over the counter, how would an average person use that over, or know how to use it over the counter? And then just what's any device? What is a device that you could use
Chairman
instead of a
Baldwin.
medication? Thank you.
Yeah, Chairman Baldwin, Senator Hutchings, a device is usually some sort of effectively a tool that contains the prescription drug to assist in its delivery. So with naloxone, for example, you have some that are come with a nebulizer so that they can be sprayed up into the nasal passage. You have some that actually are little electronic devices that will walk you through the steps and how to administer it. So there's a lot of different devices. At the end of the day, it just ends up being a different drug that's inside there. And ultimately, when a medication is transitioned from being a prescription drug to an over-the-counter drug, there's the evidence and the information in the packaging and everything to make sure that it's safe for use and people understand how to take it. There's always also the option to talk to a pharmacist and get more information and clarification on particulars of dosage or how to use it or things like that too.
Very good. Further questions?
Chairman.
Go ahead, Senator Dockstader.
Sir, how far behind are we? We were sitting on Narcan as in statute, and now we open it up to any device or medication. Are we far behind? We've got to catch up. You mentioned your rules. How do we sync up with those?
Chairman Baldwin, Senator Dockstader, we're not very far behind. In fact, when we actually had our chapter open to be putting in rules for the epinephrine auto-injectors that were put into statute last year, we did receive a lot of comments saying you should make this more broad language, and we were restricted by the statute at the time from doing so, but we knew this was in the works. So we're just waiting on the green light to make our rules, and like Senator Barlow said, we can always do things via emergency rule to make it immediately effectively if that's the pleasure of the legislature.
Thank you, Mr. Chairman.
Yeah. Further questions? Seeing none. Thank you, Mr. Marno. Anybody else wish to testify?
Morning, Mr. Chairman. My name is Allie Harris. I'm the State Health Officer at the Wyoming Department of Health. Very similar to the Board of Pharmacy, we have no concerns about this broadened definition. We do think it will increase access to these life-saving medications as these new drugs are developed, especially with the increase in the effects of fentanyl that we're seeing in the state already. Similar to the Board of Pharmacy, our rules only refer to opiate antagonists, so we would not need to change our rules if this were made effective immediately. And other than that, I'll stand for questions.
Questions for Dr. Harris? Seeing none, you're off the hook. Thank you for being here.
Thank you.
Anyone else here in the room wish to testify on the bill? Is there anyone online to testify on this bill? I thought there was going to be one.
Mr. Chairman, we do have several people online, but no one with their hand up. If someone would like to testify, they can.
If you're out there to testify about Senate File 7, please raise your hand virtually.
I'm admitting Matthew Welsh.
Matthew Welch, that's exactly who I was expecting. Welcome to Senate Committee, Matthew. Go ahead and introduce yourself and testify, sir.
Good morning, Mr. Chairman and members of the committee. It's good to see you. My name is Matthew Welsh, and I am Director of Government Affairs at Opiant Pharmaceuticals. It's an organization that is focused on developing best-in-class medicines for the treatment of addiction and drug overdose. I'm testifying in support of Senate File 7, which would remove specific references to the naloxone hydrochloride molecule in Wyoming's definition of opiate antagonist. And the purpose of this is to ensure that Wyoming is able to access new formulations of FDA-approved opioid antagonists. As the opioid crisis continues to evolve, innovative reversal agents are being developed, which may be better suited to reverse an overdose caused by synthetic opioids. As these agents become available, they will offer states, providers, and patients with more choices to combat deadly overdoses. But as currently written, Wyoming's code would preclude formulations that don't use naloxone to be dispensed. So we ask that the language be expanded to the drug class instead of being limited to naloxone. The simple change will ensure that Wyoming has access to all available opioid antagonists and will have every tool available to them in a time of this crisis. So I appreciate your consideration and hope you will support this bill.
Any questions for Mr. Welch? Seeing none. Thank you very much for coming on this morning and share.
Thank you for having me.
You're very good. Did you have your breakfast before you came on?
I did. I'm an
Okay.
hour behind you, so yes.
Oh, very good. Very good. Thank you for appearing this morning. Do we have anyone else online? Okay, very good. If there's no one else in the room, we will close public testimony. Bill has been moved by Senator Barlow. Senate File 7. Okay, we'll work through this bill page by page. 1, 1.5, 2. Would anybody like to offer the amendment to make it effective immediately?
Mr. Chairman.
Go ahead,
I
Senator.
move to amend section 2 to the standard effective immediately language.
Line 7, that's first by Barlow, second by Dockstader. Any comments, committee? We'll vote on that. All in favor of Senator Barlow's amendment to make it effective immediately, please say aye. Aye. Any opposed, say no. Oh, that amendment passes. Yeah, well, you voted, that counts. Okay, if there's no further discussion, let's go ahead and take roll call on Senate File 7, please.
Senate File 7, Senator Barlow. Aye. Senator Bouchard.
Excused.
Excused. Senator Dockstader. Aye. Senator Hutchings. Aye. And Chairman Baldwin.
Aye.
We have 4 ayes and 1 excuse.
Very good. Senate File 7, opioid antagonist amendment does pass, and the bringer of that bill will present it on the floor. I hear he's a nice guy.
Yeah.
We'll see. Okay. Okay. That brings us up to Senate File 9, Medicaid Coverage Licensed Pharmacist. Some may recognize this bill. This bill was a committee bill 2 years ago, I believe. That passed out of the interim committee and subsequently failed in a Senate committee, but we're bringing it back. I thought it was very important. Again, I'll just give you the synopsis of the bill. You can see that this one is quite long as well. Essentially, what this bill goes into section 42, 42.4.103. There's an instance where when insurance companies decide who they're going to pay for doing services and who not, they go a lot to the Medicaid list. When they do that, one of the names that does not appear on the Medicaid list is pharmacist. As pharmacists has evolved, and we've changed our practice a little bit over the last few years, things like doing immunizations. Right now, they're not on the Medicaid approved list, so insurance companies are not following through and paying for those services. The intent of this bill is just to include them on the covered entities that are paid for by Medicaid, and hopefully getting them on some of the insurance list as well. So those services are paid for. They're professionals, they go to school, they do a great job. I've never personally had an immunization from them, but maybe I will when I get home because I do need one. This doesn't affect the Practice Act at all. It doesn't affect what they can and can't do. This simply puts them on the Medicaid list and makes them have the ability to be paid both by Medicaid and subsequently by private insurances. And that's pretty much the bill in a nutshell. With that in mind, is there anybody in the audience who wishes to testify to the bill? The same suspects. Yeah. Go ahead, Mr. Martin. Introduce yourself again because we've forgotten.
Thank you, Chairman Baldwin. Members of the committee, again, Matt Martineau, Executive Director with the Board of Pharmacy. As Chairman Baldwin mentioned, this this bill would not affect or change or diminish or add to anything it is that pharmacists are already doing, and it doesn't change the board's responsibility. So from the board's perspective, we're neutral. There's others here who will speak more to it and could probably answer questions better than I could. So again, from the board's perspective, we don't have a horse in the race, but I'm more than happy to answer what questions I can that the committee may have.
Any questions for Mr. Martineau? Seeing none, thank you very much. Further testimony, come on up. Go ahead and introduce yourself and welcome to Labor and Health.
Good morning, Chairman Baldwin, members of the committee. I'm Corey Cooper. I'm the Pharmacy Program Manager for Wyoming Medicaid, and I am a pharmacist, if that applies or matters.
I think that's important.
I'm just here to let you know that if this bill were to pass, what would happen on the Medicaid end of things is that we would change our state plan amendment, update our state plan amendment with the federal government so that we would add pharmacists as an other provider in that section of the state plan so that they would know that we were intending to pay pharmacists. This is something other states have done, and I expect that CMS would be amenable to that. And then we would also amend our rules to include what types of services pharmacists were able to bill for. Immunizations is one. We expect, as we've heard from the pharmacist community, that cognitive services such as medication therapy management would also be something they would be interested in billing for. Again, all covered by the Pharmacy Practice Act. We're not looking to expand billing capabilities in Medicaid beyond what pharmacists are already able to do under the Pharmacy Practice Act. And so with that, I stand for questions if anybody has any.
Questions, committee? Senator Dockstader.
Kind of for you and for our visitor. So pharmacists just haven't been able to tap into any of this before. We've covered the services.
Chairman Baldwin, Senator Dockstader. Basically, pharmacists have not been able to bill for their own cognitive services and their capabilities. And so anything beyond what a pharmacy can bill for is all that they've been able to get reimbursed for.
Just to sidebar, follow up a little bit.
Go ahead.
Are we seeing increased use of pharmacists for these services? I personally have only used them once, but I hear of other people going to them for such services.
You talking to your mic.
Yeah.
Chairman Baldwin, Senator Dockstader, absolutely, especially with the pandemic. The extent that pharmacists have stepped up during the pandemic to provide services when folks couldn't get into their primary care providers or emergency care, absolutely, pharmacists are doing an extensive amount. Again, all already under the Pharmacy Practice Act, but certainly an expanded amount that pharmacists are doing
Thank you.
in their communities.
Thank you.
You know, and I would add to that, as I read through the Pharmacy Act multiple times in the last year, one of the things that I've always overlooked is the education part that pharmacists do. I think we've kind of walked by that a lot, and I think that's becoming more and more important. I know I depend on it when I give prescriptions to my patients, and I expect and I appreciate that the pharmacists are able to then do some education and counseling on the medications to the patients. That's a big deal, and I'd like to see that happening more. That's just a side note. Any further questions, committee? Thank you very much.
Thank you.
Anyone else in the room wish to testify? Come on down.
Good morning, Chairman Baldwin and committee members. I am Melinda Carroll. I'm here speaking on behalf of the Wyoming Pharmacy Association and its members. As many of you know, I am also a practicing community pharmacist, and today I would like to provide testimony on why it is important to pass Senate File 9. Pharmacists are highly trained healthcare professionals who have expertise in the safe and effective use of medication. Today, 53% of US licensed pharmacists are doctors of pharmacy who receive as much classroom clinical instruction as medical doctors. The pandemic increased opportunities for pharmacists to deliver hands-on care. The Department of Health and Human Services gave pharmacists the authority to order and administer COVID-19 tests, childhood vaccines, and COVID-19 vaccines. This is in addition to the long list of services and medications that pharmacists were already allowed to provide. Subsequently, pharmacists, interns, and pharmacy technicians were on the front lines testing for COVID-19, giving shots, and educating the public, all the while keeping their doors open throughout the pandemic, where many others closed or had limited hours and patient interaction. These efforts offset the burden on other parts of the healthcare system. The pandemic was a unique situation that showed that pharmacists as providers play a vital role in improving patient outcomes by providing hands-on care to patients in addition to medication counseling, identifying and preventing drug interactions, and managing chronic diseases such as diabetes and high blood pressure. Pharmacists also identify and resolve medication-related problems and provide preventative care services such as vaccinations and screenings. Additionally, pharmacists can serve as a valuable resource for patients and other healthcare providers by providing information on the latest research and treatment options for various medical conditions. As previously stated, pharmacists play a critical role in the healthcare system and provide a wide range of services to patients. Numerous studies, such as role of the pharmacist in reducing healthcare costs, current insights found on PubMed, prove these services have been shown to improve patient outcomes, reduce healthcare costs, and promote overall wellness. Despite this, pharmacists are often not reimbursed for their services they provide like other healthcare professionals. You may ask yourself, why is this? Legislative changes are required to allow for reimbursement of pharmacist services and further expansion of the pharmacist's role in primary care, providing a valued service to Wyoming citizens, while also helping to relieve healthcare shortages in our state. Paying pharmacists for their services would provide them with the financial resources they need to continue to provide high-quality care to patients. It would also allow pharmacists to invest in the latest technology and tools, which would help them provide even better care to patients. Additionally, paying pharmacists for their services would help attract and retain talented professionals in Wyoming, which would benefit patients and the healthcare system as a whole. In summary, pharmacists are an integral part of the healthcare team. Their services are vital to improving patient outcomes, and they should be compensated for the value they bring to the healthcare system. Failure to do so would limit the access and quality of care for patients of Wyoming and ultimately increase our already high healthcare costs. And with that, I would stand for questions.
Questions, committee? No, none. Okay, you got off easy today. Oh, before you run away, Senator Duxbury.
How many are actually in your, how many registered pharmacists we have in your program process?
Chairman Baldwin, Senator Dockstetter, I think that
I see a lifeline coming up behind you.
a better question for Director Martineau. He will have that number for you.
Chairman Baldwin, Senator Dockstetter, members of the committee, again, Matt Martineau with the Wyoming Board of Pharmacy. In answer to your question, Senator Dockstetter, with a Board of Pharmacy licenses approximately 1,500 pharmacists, of which approximately 600 reside and work in the state. I'd have to do a little bit more research to see how many of those 600 hold an active license. Of those 600, though, I know that there were just about between 300 and 400 who had an immunization registration back when we had a separate registration in order to do that, in order to provide immunizations.
Mr. Chairman, most are part of this program. Most of our pharmacists across the state are part of this program, part of what you do.
Chairman Baldwin, Senator Dockstetter, can you, I'm not sure I understand
Of
your
those
question of
numbers
the
you just,
program.
Mr. Chairman, of those
Right.
numbers you gave me, everybody, for the most part, the biggest percentage are registered with you.
Chairman Baldwin, Senator Dockstetter, yes, in order to practice pharmacy as a pharmacist in Wyoming, you have to have a license from the board. So the 600 pharmacists who live in Wyoming, approximately, if all 600 had an active license, approximately 300 of them would be working in a community or a retail pharmacy setting, which would line up with the number of immunization registrations that we had, because that's where most pharmacists have the opportunity to provide immunizations. A pharmacist who works in a hospital setting doesn't usually have that level of patient interaction, and immunizations tend to be handled by the nursing staff for the rest of the hospital staff and the patients and things like that.
Thank you.
Good. Further questions? I have a question that has nothing to do with this, but 2 years ago, 3 years ago, we passed the telepharmacy bill. Have we had any registered, or do we have any telepharmacies in the state now?
Chairman Baldwin, we still only have 3. And it gets to reimbursement issues where it's becoming increasingly difficult to be profitable as a pharmacist or as a pharmacy.
Very good, thank you. Okay, no further questions? Go ahead and have a seat. Anybody else in the audience wish to testify to this bill? Welcome to Labor and Health.
Well, thank you, Chairman Baldwin. Committee, my name's Tom Laycock. I'm with AARP Wyoming, and we'll be short and sweet. And please feel free to apply this particular testimony to Senate File 37, which is coming up as well. AARP is supportive of this bill as well as the next one. You know, our policy stance is that we support allowing all professionals to provide services to the full extent of their current knowledge, training, experience, and skills where evidence indicates those services can be delivered safely and effectively. So you've talked about the changing role and the evolving role of pharmacists, and we see the same in the podiatry world, especially as it relates to diabetic care. So that said, we're supportive of both. Thank you very much for consideration.
Very good. Questions from Mr. Laycock? Senator Hutchins?
Thank you, Mr. Chairman. Mr. Laycock, just a quick question here. If this bill was not passed, the pharmacist's duties, responsibilities, wonderful things they do for the community would not change, which is adding the Medicaid component. Is that correct?
Mr. Laycock?
Chairman Baldwin, Senator Hutchings, that's probably a better question for Director Martineau.
Well, we'll bring both lifelines back up briefly to answer that question.
Thank you.
I consider that a scope of practice question, sir.
Sort of, not really, but kind of. But thank you. Go ahead, Mr. Martineau.
Chairman Baldwin, Senator Hutchings, with respect to the question, not every pharmacy engages in these sorts of additional practices because they aren't reimbursed for them. And the pharmacies that end up doing them, they do so at a loss. So I don't know if I'm crossing a line. There is some element of public safety to this bill, because as reimbursement gets tighter and tighter and tighter, staffing gets similarly tighter and tighter and tighter, to where no one is perfect and errors would be increasingly likely to occur because script volume doesn't change, number of vaccines that need to be administered doesn't change, but staffing decreases. And so the likelihood for error would continue to increase.
Go ahead. Additional answers? Nope. Go ahead. She wants to say something.
Chairman Baldwin, Senator Hutchings, this is absolutely to do with reimbursing for what pharmacists are trained and capable of doing. And it seems to be very focused on the Medicaid program. However, this listing pharmacists as providers with the Medicaid program opens it up for private insurers, because they oftentimes reimburse based on what the Medicaid program in the state reimburses. Pharmacists are healthcare providers and should be recognized as such.
And I'll throw in just a side there, and what I suspect is that the free market may affect that. If we don't pass this, if there is no reimbursement, that not just the Medicaid, but it's the private ones, I suspect will be more effective, because some of these pharmacists are going to quit giving these services. You can only do things at a loss for so long, and then you cut back, because the cost of the medicine, the cost of the immunizations is not ever going to come down. It's going up. So that's my suspicion, is you'll probably lose some of these services because it's not cost effective for them. Good. But follow up, Senator Hutchins.
Thank you, Mr. Chairman. You know my love and the hard work and hours I've spent with the pharmacists. And I know full well what they do. And it is amazing. Medicaid, the coverage there is anything that was a problem with me. But that was it, Mr. Chairman.
Thank you, Senator Hutchings. Further questions, committee? Okay, you all three can sit down briefly. Don't get attached to your chair. You may be called back. Anyone else in the room wish to testify to the bill? Seeing none, anyone online for Senate File 9?
If anyone online would like to testify, if they would please raise their hand.
Raise the virtual hands if you wish to testify. No virtual hands appearing. We'll close public testimony. Committee, what's your pleasure? Bill moved by Senator Barlow, second by Senator Dockstader. Oh, a virtual hand must have appeared.
Mr. Chairman, I'm admitting Matthew Meyer.
Matthew Myers.
Mr.
Mr.
Meyer
Meyer,
just
we're waiting
needs
for your
to
face and your voice.
turn on his video and his audio.
Yeah, if you don't have your video and your audio on, go ahead and turn them on. There he is. We see you. Go ahead, sir.
All right, good morning, Mr. Chairman. My name is Matt Meyer. I'm an independent pharmacy owner here in the state of Wyoming. And I'll keep my comments brief since Melinda Carroll and Matt Martineau and everybody has already touched on most of the topics of this bill. But one of the things that we keep coming back to as add-on services for pharmacists as providers and listing them in the state Medicaid registry is that you are absolutely correct. Medication reimbursements are going down all the time, and these additional add-on services such as COVID testing, influenza testing, diabetic education, if from a business standpoint, if we cannot continue to, or if we cannot get paid for those services, they will eventually go away. And one thing that the COVID-19 epidemic has shown us is that there are a lot of underserved populations in the state of Wyoming and a lot of people who are not plugged into the healthcare system already. When those people need services, you know, the pharmacy is generally the first place that they appear. And if they can't find those services here at the pharmacy, then it's trying to get plugged into other areas such as urgent cares, which may be overbooked, or primary cares, or the emergency room. And everybody is 100% absolutely correct in this fact that if pharmacists are not listed as providers on the state Medicaid registry, we're not going to get added on for the commercial payers either, and those services will eventually disappear. Right now, it's at the insurance party's leisure to determine whether or not they will recognize the services that we provide for medication counseling and therapies, point of care testing, et cetera, as to whether or not they will reimburse us. So this is the first step of many that are needed to continue to get access to those vital services for patients and citizens here in Wyoming. Since 22 out of 23 counties are registered as deficient in healthcare providers. So with that said, I'd be happy to stand for questions.
Thank you very much. Questions, committee? Seeing none, I have to compliment you, sir, on the artwork there on your bulletin board. Is that done by yourself or one of your children?
I wish I could take credit for it, but no, those are from my 7-year-old.
Well, perhaps you'll be able to retire because they may have a future in art.
There you go.
Thank you very much for testifying today. We appreciate your testimony. Committee, back to you. The bill's been moved and seconded. Any discussion on the bill? Changes, amendments? See none. I heard suggested somebody thought about making this one immediate. Any movement that way, or would you like to keep it as it is? Sensing no movement. Oh,
Let me just ask,
go ahead.
how do you see this, Mr. Chairman, as tracking? Do you see the importance of the EDC?
Oh. Go ahead and say that one.
Mr. Chairman, you've been tracking this all the way through. Do you see the importance of making this an immediate piece of legislation?
You know, here's my sense, and my sense is this, and they can back me up or say he's an idiot. But I think that the rulemaking is so easy on this one I think it's just a brief thing, and I think effective in July, I think absolutely it would become effective very quickly. I think rulemaking, but I don't think there's an urgency as there was with the other. Oh, go ahead and comment. Go ahead, ma'am. Introduce yourself one more time, please.
Chairman Baldwin, members of the committee, I'm Corey Cooper. I'm the Pharmacy Program Manager for Wyoming Medicaid. And I believe that probably the July 1st date is most reasonable, given the fact that we do have to, in order to make it effective, we do have to go to our federal partners at CMS and do a state plan amendment change. And so that will take a little bit of time. It's not a difficult state plan amendment, but we are beholden to the schedule of CMS, which I can't guarantee would be immediate or super speedy. So,
Very good.
thank you.
Thank you for that help. Okay, committee, further discussion? If not, it's been moved in second. Let's take a vote on Senate File 9, please.
Senate File 9, Senator Barlow.
Aye.
Bouchard is excused. Senator Dockstader. Senator Hutchings.
No.
Chairman Baldwin.
Aye.
I have 3 ayes, 1 no, and 1 excused.
Senate File 9 has passed the Senate Labor and Health Committee.
Can I insert a question, Mr. Chairman, to you? I've heard repetitively this morning problems with reimbursement. This is an ongoing thing. It's increasing recently. We're just not seeing the reimbursement get out to pharmacists. Should in their situations, there's delays.
You know what I suspect, and this again is just my suspicion, is that we're seeing those services utilized more, partly because of COVID, partly for other reasons, but I think we're seeing more utilization of services and the lack of reimbursement is being recognized more. Now, I would add to that, and this is not a popular thing to talk about, but the reimbursement that Medicaid and Medicare give is substantially below the cost of giving care. And you'll hear more about that in this committee as we go, thus the unreimbursed care to hospitals. But I think in my mind, there's more utilization of these services. And so the lack of reimbursement is being more and more recognized. And that's what I think. And so we're seeing it more.
Thank you.
Okay, committee, let's move on to Senate File 37.
Excuse me, Mr. Chairman, who would like to present this on the floor?
Nobody wants to. Oh, I will go ahead and present that on the floor.
Thank you.
Senate File 37, Podiatry Medical Services Medicaid, which is going to be very much a deja vu for you, committee. This is very similar to the bill that we just heard. This is in the same section in 42.4. This goes into who's authorized under the registry, under the Medicaid registry as a provider. This one perhaps a little bit more recognized widely than the pharmacist one because it affects the diabetic population with a much greater urgency. With that in mind, all this does is add podiatrists to that registry, thus makes it reimbursable by private insurances as well as Medicaid, and probably, again, as important or more important to the private insurance companies. With that in mind, I know we've got some folks wishing to give testimony. First of all, let's start in the rooms with agencies. Anyone wish to give testimony? Welcome. I was afraid you weren't going to get up this morning. Welcome.
Good morning. I'm Jesse Springer with Wyoming Medicaid. I'm the Technology and Business Operations Unit Manager. I also do fiscal notes. Main role I had is preparing the fiscal note for this bill. We provided an original estimate for the cost of the bill based on the existing cost for Medicare. So the cost that we cover dually eligible members. And we can see what Medicare paid for those people to have podiatry services where Medicare is a covered service. So we were able to estimate for the individuals that are age 40 and above that are not on Medicare, which there's about 5,000 people, what we think it would cost to give those individuals podiatry services. Other states that have done this have also estimated offsets. We did not estimate offsets, but there is some possibility for offsets from avoiding inpatient care for primary diabetic ulcers. So preventive care, but also recovery care, where right now that's not covered specifically at podiatrists. So that's to think about this, if you have a foot issue, Medicaid will cover it. It's just not covering it at a podiatrist. So you're adding really the specialty that can actually help on the problem versus we would cover someone who has a foot problem. They could go to the emergency room. They could go to inpatient care at a hospital. They could go to primary care or a number of other physician specialties. They just could not currently go to a podiatrist that's independently practicing. They might even see a podiatrist at an inpatient setting, and that would be covered, but they couldn't independently go to a podiatrist. So that's my general summary of our perspective on the bill. We did the fiscal note, we did some estimates, and I'll stand for questions.
Senator Barlow has a burning question.
Thank you, Mr. Chairman. Great to see you, Mr. Springer. So the estimate you did is assume that all 5,000 folks that are 40, not eligible for Medicare, but over eligible age, would require these services based on some average cost that the Medicare patients did. Is that accurate, Mr. Chairman? I mean, what I'm saying, this is the sky, that everybody needed the services, and it was everybody had the annual average of what Medicare would. I'm just want to understand the fiscal note. Thank you, Mr.
Chairman
Springer.
Baldwin, Senator Barlow. Yeah, thank you for having me here today. So we only estimate $1.88 per member per month. So we don't estimate that 5,000 people will actually use this service. Probably, a much smaller proportion of that. Franz Fuchs actually did some estimates of this that involve a lot of scatter graphs and but we distilled that down to say, because what we have to do is say, we have 5,000 people who possibly could use this service. Some proportion of those will use the service. So our estimate based on the Medicare experience is that it'll be $1.88 per member per month, which translated into what I believe the sponsor included as the appropriation for 1 year. But most, this is going to be focused on really probably diabetic care or individuals that have some sort of foot issue.
Thank you. Further questions from Mr. Springer, Committee? Seeing none. Thank you very much, Jesse. Good to see you today. Anyone else in the room wish to testify to this bill? Welcome to Labor and Health, Ms. Bush.
Good morning, members of the committee, Mr. Chairman. Sheila Bush with the Wyoming Medical Society. We're here in support of this bill this morning. When I asked our members, they gave a variety of stories about the trouble when taking care of a patient, especially a diabetic patient. Getting them care from a podiatrist can be challenging, and getting that reimbursed is hard. And so they thought this was a good idea, and they're in support.
Very good. Questions from Ms. Bush? Senator Dockstader.
Ms. Bush, I don't know if this is something you answer. In my area, I've heard of podiatrists working through our hospital, yet I've seen them working through a chiropractor's office. Today I walked into one of our town halls to visit with the mayor. Town council chambers being occupied by a podiatrist and a patient to work over the foot, so to speak. And so where do podiatrists fit in the big picture? Do they have to work through hospitals where they can be independent and still collect for these services? Do you know?
Ms. Bush, go ahead.
Mr. Chairman, I don't know the answer to that question. I believe they can work independently. I think there's a variety of ways that they can provide their services, and it can range from an independent clinic that they stand up to being housed within a primary care clinic, a chiropractor's office, or a hospital.
Yeah, they are considered independent practitioners. As coincidentally, several do work within hospitals or at a clinic, but several podiatrists also maintain their own clinics, and they are independent. Further questions for Ms. Bush? Okay, thank you very much. Okay, anybody else in the room wish to testify? Seeing none, I know we've got a couple online at least.
If the people online who'd like to testify would raise their hand, I can admit them. Mr. Chairman, I'm admitting Carissa Kemp
Very good.
and Benjamin Kerlock.
Okay, Ms. Kemp. We're anxious.
Hi, everybody. My name is Carissa Kemp, and I'm the Director of State Government Affairs for the American Diabetes Association. Thank you so much for allowing me to testify in support of this bill, and thank you specifically to Chairman Baldwin for your work on it and committee members for allowing me this opportunity. The bill to add podiatry coverage for Medicaid is critical for people with diabetes. In Wyoming, approximately 38,000 people, or 8.3% of the adult population, have been diagnosed with diabetes. An additional 12,000 people have diabetes but have not been diagnosed, greatly increasing their risk of complications. And every year, an estimated 2,000 people will be diagnosed. Diabetes can cause nerve damage and reduce circulation, which can lead to limb loss and other complications. Additionally, people with diabetes may develop diabetic foot ulcers. When left untreated, diabetic foot ulcers, also referred to as DFUs, can become a portal for infection, with more than half of DFUs leading to higher rates of ER visits, hospitalizations, and amputations. Podiatrists are specifically trained to assess the nerve damage in feet, identify foot health risk, and help create a plan with patients to reduce the risk of complications. This bill and the timing of this bill is particularly important because amputations are on the rise in the United States. Just last year, there were over 154,000 diabetes-related amputations, and of the non-traumatic lower limb amputations, 60% occurred in the diabetes population, and of these, 85% are preventable. How can we prevent them? By checking feet daily, going to regular doctor visits, and wearing proper footwear, all of which patients can work with their podiatrist on. We can reduce the risk of amputations. I also want to make an important note, which is that by having these patients see a podiatrist, it can actually reduce the risk of hospitalizations by 24%. In Arizona, the legislature eliminated Medicaid coverage for podiatry services to create what they hoped for was cost savings. Instead, eliminating podiatry coverage adversely impacted the diabetic patient health and increased costs to the state. A study found that from each $1 of Medicaid program savings the state had hoped for, it actually increased cost of care by $44. In addition, the state experienced 37.5% increase in diabetic foot infection hospital admissions, 28% or almost 29% longer lengths of patient stays, and nearly a 50% increase in severe aggregate outcomes. According to the Wyoming hospital discharge data that is available from July 2020 to June 2021, there were about 253 patients discharged from Wyoming hospitals that had diabetes and also had a diagnosis for lower extremity amputations. While this does not mean that they had an amputation during that visit, they did have a lower extremity amputation issue that required at least one night stay in the hospital. The hospital charges for those patients totaled nearly $14 million. By passing Senate Bill 37, Wyoming can improve patient outcomes and save costs by reducing the risk of amputations, hospitalizations, other complications associated with diabetes, foot ulcers, and even deaths as it relates both to diabetes and DFUs. I appreciate your time and urge your support.
Questions for Ms. Kemp, committee? Thank you very much, Ms. Kemp. That was a lot of good information and data there. And I can't help but think about through my own practice of feet that I've seen that haven't been cared for. It's one thing to say amputation, and it's another thing to see it and experience infection in a foot and in a lower leg. It's quite a different scenario. It's something that's in your mind that you'll always see. And if we could have illustrations, I'd show you, and we can smell it, the gangrene, but we won't. Thank you very much, Ms. Kemp. We appreciate you coming in and testifying today. I believe I see Benjamin Kerlock. Did I pronounce that right, sir?
It's Caroline.
Oh, there you are. Go ahead. Oh, we lost your audio. I'm sorry. We got your video. It's like one of those silent movies right now.
Okay, let's see if is that working?
Much better. Go ahead and reintroduce yourself and go ahead and start.
Okay. My name's Benjamin Kerlock. I'm a podiatrist, and I was coming today to talk about diabetes, but as I feel that Ms. Kemp covered that fantastically. I would like to just speak with respect to the role of podiatrists in healthcare systems, specifically rural critical access type institutions, which is where I work. At this time, it's kind of come up today repeatedly with the pandemic. Healthcare systems have found themselves increasingly strained, understaffed, and overstressed. And in rural healthcare systems, podiatrists offer services that can reduce the burden on other providers. For example, our orthopedic surgeons or our general surgeons. In our facility, we're 55 miles away from the next nearest hospital over a mountain pass. And we have one orthopedic surgeon who covers all of our call. And we have 3 general surgeons who are on 24-hour call once every 3 days. And being able to reduce the amount of time they're coming in for draining abscesses, doing diabetic amputations, dealing with minor fractures or traumas allows them to survive the burdens they're placed under. We're increasingly as podiatrists being called in the middle of the night to deal with these things, to provide relief to these other overworked providers. And so our facility, for example, we have a high percentage of agricultural laborers in the area, high percentage of Medicaid, and being able to see these patients, get them the care they need, and have our facility be reimbursed for these services is something that we would find very helpful.
Thank you. Questions, committee? Seeing none. Thank you very much. Now I'm going to guess that that's Austin in the corner. I have to tell you, sir, it's hard to read the names from here. But if that's Austin, you shook your head, I must be right. Go ahead, Mr. Matthews.
Chairman Baldwin and members of the committee, my name is Austin Matthews. I'm a podiatrist practicing in Torrington and Wheatland. I'm the only podiatrist on staff at Platte County Memorial Hospital, as well as Banner Torrington Community Hospital, where I currently serve as the Vice Chief of Staff. I'm here today to express my support for Senate File 37 and for adding Medicaid coverage for podiatry services. I've lived in states where podiatry has been covered and in states where it hasn't been, and I've seen the difference firsthand. I was actually a student in Arizona when, as Ms. Kemp talked about, Arizona eliminated Medicaid from its coverage, or eliminated podiatry coverage through Medicaid, and I saw firsthand the consequences of that. Not only does adding Medicaid coverage for podiatry ensure high quality care to our patients with Medicaid, adverse events such as hospitalizations and amputations can be prevented. By preventing amputations and hospitalizations, overall healthcare costs are reduced. Podiatrists such as myself treat a wide variety of conditions ranging from the relatively mundane to life and limb-threatening conditions. We treat patients in the office, in the hospital, as well as in the operating room. We perform complex reconstructive foot and ankle surgeries for fractures, congenital deformities, and degenerative conditions. We are uniquely trained and qualified to treat hard-to-heal diabetic foot wounds, prevent amputations, and get patients back to full activity. By adding Medicaid coverage for podiatry, you can ensure access to expert foot and ankle care for thousands of patients. I believe this will help not only prevent amputations, but it will keep more people in the state of Wyoming healthy and active. And I thank you for your time, and I stand ready for any questions.
Questions, committee? Seeing none, thank you very much for your presentation. Do we have anyone else online? No. And I just had a sudden flash in my memory here as I got a message yesterday with a picture of a foot. I won't share it to anybody. It's a picture of an infected foot that got life flighted. Anyway, that aside, if there anyone else to give testimony online, not in the room, not? Committee, what's your pleasure? Moved by Senator Barlow. Okay, committee. Any suggestions, questions? Nah, we generally in this committee go without seconds. Suggestions, comments, additions? Senator Barlow.
Thank you, Mr. Chairman. So obviously this bill needs to be re-referred to our Joint Appropriations Committee because it has an appropriation in it, so that'll go there. And I guess My question is, I would assume they're going to strip the appropriation out of it and say this can get just absorbed into our current, the current plan. That's just what I would not be surprised by. So I guess for you as a sponsor, how critical is appropriation to the bill? We didn't have it in the previous one. We didn't think there was an additional one. So I guess what I'm saying is, if you'd like to strip the appropriation and avoid that discussion in JAC, I could make that motion. But if you want to go through that process, you're at your leisure, Mr. Chairman.
I guess I would address somebody in the audience here, just see if we stripped that appropriation, what would the consequence be? Perhaps Mr. Springer, being the numbers professional in the room.
Chairman Baldwin, Senator Barlow, given the expense here and the expected offsets to inpatient, likely is of the scale that Medicaid in its current budget could absorb. That's to your pleasure. Do you fund this? What would happen is if this exceeded this cost level, or we didn't see decreases in patient admissions that offset this cost, we would come back with an exception or request on this bill next year, probably, after implementing and getting real experience to see, did we see a decrease in inpatient admissions for diabetic related causes? Did that offset the amount that we spent here? Given our current budget situation, we probably could absorb this. So I can't speak for the director of the Department of Health, but given there were offsets identified, we just didn't price them. And the scale of this is not catastrophic to the Medicaid budget.
What I was looking to hear from Mr. Springer was, and if there is a cost savings, we'll ask for a reduction in our budget. I didn't hear that. No, thank you very much. I think that's exactly what we were looking for.
Chairman Ball, we have delivered some of those.
Yeah, thank you very
Thank
much,
you.
Jesse. I appreciate it. That being said, I would feel secure pulling the cost out.
So, Mr. Chairman, and I don't know that this actually prevents it from going to JAC, but I think we could make the case with the leadership that we pull the appropriation ourselves, therefore there's no need to go to JAC. But the problem is that the body has to adopt the amendment before it's actually in place. So I don't know that we actually skip this step or not. You have a former president. You can ask your former president.
Mr. President, or Mr. Chairman, I'm hesitant with the money in there at the committee level. I would probably hold back if that money is in there. If you feel comfortable as chairman, we can pull that out and move it on to the floor. And, leave it in there and let it be absorbed, but at this point, I don't want to add expense.
Okay.
Mr. Chairman.
Go ahead, sir.
Chairman, so can we work the bill?
Yes, we can.
All right. I move to strike section 2, renumber section 3.
Okay, that would be the amendment that we're talking on page 2, starting with line 6, of getting rid and deleting section 2 and section 3, or not section 3, excuse me. We better leave an effective date. So you've heard that. Any discussion on that committee? And I will actually discuss that with leaders. When I get back today, I'll talk with them about it, see if they agree with that. And if that would get rid of the need to take this to the approval. Okay, you have heard the motion on that amendment, striking section 2 on page 2, line 6 onward. All in favor of that amendment, please say aye. Aye. Everyone voted that time, Senator Barlow. All opposed, say no. So that amendment passes. We get that okay, staff? Got it. Okay, anything further, committee? Seeing nothing, let's go ahead and take a roll call vote, please.
Roll call on Senate file number 37, Senator Barlow.
Aye.
Shard is excused. Senator Dockstader. Senator Hutchings. No. Chairman Baldwin.
Aye.
We have 3 ayes, 1 no, and 1 excused.
Very good. Maybe that concludes our work and we're 25 minutes early.
And will you present, Chairman?
I will present that bill, yes.
Thank you.